Then I had my daughter freshman year of community college, and I never gave up. I still wanted to become a doctor. I just knew it was going to look different for me. I didn't know how it was going to look, and I couldn't envision it the way it is now. But I just knew, okay, I see the end goal, and I know it's going to be a windy path, and I know there's going to be a lot of challenges, but I just knew that if I keep my eyesight there, then we'll be fine. So I went to UC Berkeley with two C pluses, and I graduated with zero debt. They gave me a scholarship because they wanted to uplift student parents. If I would have listened to other people, like my counselor, or even other people as well, if I would have listened to that and excluded myself out from the get-go, I would have never had these opportunities. I've learned that's important. Like sometimes after a full day of studying, I was like, yeah, I can study for 4 more hours, especially when I had a cup of coffee. But then I was like, but I'm gonna be missing out on my daughter's game. And she's not gonna remember to score her game. And I'm not gonna remember even what I studied. One thing I am gonna remember is creating those memories with her. Hey, do you remember that hot day in May where you saved the goal? I think those memories are worth more in value than studying an extra 4 hours.
Hello, everyone. This is Dr. Moss, and I am speaking with an amazing fourth-year medical student today. Introducing Juan Medina, a trailblazer in every aspect of his life's journey. He's a first-generation student in higher education and currently navigating the rigors of medical school. Juan's story embodies resilience and determination. Despite his initial aspirations for pre-med path after high school, he became a father at 19 and prompted a swift pivot towards nursing to support his family while immersing himself in the medical field. With unwavering support from his wife and children, Juan has traversed the academic landscape from Alone Community College to UC Berkeley and now finds himself at Chicago Medical School. Notably, he proudly serves as the first Mexican-American class president in his medical school, breaking barriers and inspiring others along the way. As an MS4, Juan's aspirations extend beyond personal achievement. He harbors a profound desire to give back to his community by becoming a psychiatrist, aiming to provide much needed mental health support to underserved populations. Yet, amidst his academic and leadership endeavors, Juan's most cherished role models are that of a non-traditional soccer dad, seamlessly balancing the demands of parenthood with his passion for sports. Join us as we delve into the remarkable story of Juan Medina, a beacon of inspiration and a testament to the power of perseverance in pursuit of one's dreams. Welcome, Juan.
Thank you so much, Dr. Moss. Congratulations to you for finishing medical school and graduating. Thank you so much for inviting me. I'm here to share my story and to motivate others too. I think that's the main thing I would love to do is to motivate other people that look like me or have similar backgrounds, maybe became parents at a young age, or maybe they are a nurse and they've been thinking about, hey, maybe I should think about going to the doctor route or nurse practitioner or anything like that. I really want to motivate all the viewers.
I
Yeah.
love that. Now, the bio touched on some really interesting aspects that are, I would say, non-traditional in the medical school path. So tell me a little bit more about your story.
Yeah, so I had my kids when I was 19 years old, freshman in college. I still remember the first day and like, I'm gonna be a parent. And I was like, okay, what do I do? There's no handbook for a parent at a young age. So I had to really create my own handbook. I had to create my own path because ultimately being first generation, having a first generation immigrant family, we didn't have the financial resources, the funds to raise a family. So then like, immediately, like any college student researches, I was like, okay, what can I do that can fulfill my destiny in medicine, but at the same time help me raise my daughter? So then that's when I decided to like quickly pivot to nursing. That will fulfill my destiny in medicine. It'll help me raise my daughter. And I think it was honestly one of the best moves I've done in my life thus far. I was really able to dive deep into medicine. It's all about teamwork in medicine. And I was able to learn the team dynamics and the role of the doctor, the role of the nurse, the role of the CNAs, the role of the custodian. Everybody plays a key role in medicine. And I think that really made me appreciate all the team players in medicine. But at the same time, it gave me the financial stability to raise my daughter. And it gave me the financial opportunities to pursue higher education as well. So I was just talking to my wife about this today, but I still remember the times where I used to work at night as a new grad nurse, drive to the community college, and I used to sleep in my car for an hour or two, and then I go to class half asleep. But no matter what, I never stopped though. Even if I was half asleep, like just being in that room, like in the classroom, it was just motivating. Maybe I didn't listen to the lecture 100%, but it was motivating for me. Okay, I'm still going, I'm still showing up. You just don't give up. I worked nights, I worked days, and time management was key because I didn't want to neglect my kids. I didn't want to neglect my wife, but I also didn't want to neglect my work and school. So it was very tedious. It was week by week. And everybody always asked me, how do you do it? How do you do it? You went to community college, undergrad, and then medical school. Like, how do you do it? I always used to say, I don't know, I just keep going. But then my wife has been like being inspiration to me, just seeing her. She just graduated from Marquette University and MSN. So just seeing her is motivating for me. At the same time, time management is key. One thing I learned from nursing is triage. In medicine, when we talk about triage, most of the time we think about the emergency room, but you can also apply it to life. How I triage life is what needs to be taken care of right now, what can wait for a week, or what can wait till a couple of days. So in that sense, I learned, thanks to nursing, that mentality of triage, like how to tackle each thing one by one.
I'm really glad you said that because it's so true that in order to become successful and manage family life, health, school, all that, there is so much that has to be done. There's always a never ending list of to dos. So I really like that you gave the example of learning that skill of triaging what's important, what do I need to do now? Do you think raising kids also helped with that skill development?
Yeah, definitely. When they were babies at first, it required a lot of attention, a lot of us being home and making sure, do we have food for them? The basic necessities, does the diaper need to be changed? Stuff like that. But as they grow older, you see that transition. Now they have school activities. My son loves band, so he has band concerts, jazz concerts, and little sports. So it really requires time management. I told one of my classmates, we had a student leadership retreat, and I told him, I think I'm at the point in my life where for me is studying extra 4 hours. Is that gonna really make a difference when I go take the test the next day? Or are those 4 hours better spent on making memories with my kids and making sure I'm there for them as well? So I think for me personally, I've learned that's important. Like sometimes after a full day of studying, I was like, yeah, I can study for 4 more hours, especially when I a cup of coffee. But then I was like, but I'm gonna be missing out on my daughter's game. And she's not gonna remember the score of her game. And I'm not gonna remember even what I studied. One thing I am gonna remember is creating those memories with her. Hey, do you remember that hot day in May where you saved the goal? I think those memories are worth more in value than studying an extra 4 hours.
I completely agree. Very similar with my husband. We were both in medicine. So that was really important. We would have a day off, but we would go to a museum. And instead of enjoying the museum, we would study. And it took time to be like, okay, do we really need to study? Can we just take
Yeah.
1 hour to
Yeah.
go and enjoy the museum or a
Yeah.
couple hours? Like you said, it's not going to impact long term of knowledge and being
Yeah.
successful.
It's so hard, right? Especially in medicine and nursing. You have that mentality like, oh my God, I need to remember every single little thing, which is true to an extent. But as a culture where it really makes you not take care of yourself or family, we call it FOMO. Like you're gonna fear of missing out information, but you won't. As long as you give high quality time to your studying, you can move things around in your schedule and make it possible.
I would love to hear a little bit more about the various challenges that you encountered throughout your education and how you navigated them.
Yeah, definitely. Let's see. I can talk about educational challenges, financial challenges, anything in particular you wanted, or
It's really up to you. Everyone has a different, whether if that is their mental health, whether that's finances, whether that's just managing your own. It really, everything is welcome.
yeah, so I can talk about my educational challenges. I think as a student parent, it's been really hard, right? Because I'm competing against the pre-med track and trying to get into medical school. You want perfect scores and everything. And as a parent, that is super hard because, like I said, I was working, I was school, and I was studying at the same time. So that was very hard. I feel like that was my challenge as a student parent, is managing everything. I didn't have stellar grades all the time. Even when I transferred from Millennium College to UC Berkeley, I had perfect A's, but there were some classes where I just didn't get it. Calculus was one of them, and I got a C plus, Calculus 1 and Calculus 2, but that didn't stop me from pursuing what I wanted to do. There was many counselors that told me like, "Hey, you have two C pluses, you're never going to get into UC Berkeley." But I wanted to get into UC Berkeley because it was the only undergrad in California that had public health, and especially since I was a nurse, I saw things differently now as more like a public health point of view. And I had to do an extra year at a community college to take those courses to transfer. But even then, there was counselors at my community college that told me not to apply to UC Berkeley because I had those two C pluses in my transcript. I didn't want that to determine the outcome. I was like, I'm gonna apply. If I get in, I got in, but at least I was in control of my destiny. I applied and I got in. They even gave me a scholarship because Berkeley was the only university that had scholarships for student parents, which is a very unique program that I thought was really cool. So just talk about the scholarship really quick. They pay full tuition, they gave me financial aid, and they gave me full housing for the 3 years I was there. So I went to UC Berkeley with two C pluses, and I graduated with zero debt. They gave me a scholarship because they wanted to uplift student parents. If I would have listened to other people, like my counselor, or even other people as well, if I would have listened to that and excluded myself out from the get-go, I would have never had these opportunities.
Oh my goodness, that's amazing. I'm so glad they had that program. At what point did you transition from being a nurse to saying, I'm going to go and apply to medical school?
Yeah, so I'm really glad I asked that question because I'm first generation and I had no idea about college. Like I didn't apply to college till maybe like halfway senior year, and then by then they're like, "Oh, sorry, all applications were due already." And I didn't even know about financial aid either. So I just knew I wanted to be going to medicine because when I was 16, I took a CNA course, a certified nursing assistant course, and I loved it. And that's when I solidified I definitely want to do something in medicine. Then I had my daughter freshman year of community college, and I never gave up. I still wanted to become a doctor. I just knew it was going to look different for me. I didn't know how it was going to look, and I couldn't envision it the way it is now. But I just knew, okay, I see the end goal, and I know it's going to be a windy path, and I know there's going to be a lot of challenges, but I just knew that if I keep my eyesight there, then we'll be fine. Even though my daughter was born when I was 19, I still had that mentality. I want to be a doctor. But how I get there, I knew it was going to take some time. At the same time, while I was doing nursing, I loved it and I miss it to this day. And my coworkers tell me once you're a nurse, you're always a nurse. And it's true, right? Because you see things differently. I always say good morning to the nurses. I always say good afternoon. Is there anything I can help with? They value that a lot because I knew when I was a nurse, like things got busy really fast and it's just a simple good morning or good afternoon. Hey, how are you? Is there anything I can help with? It goes a long way. I noticed that has helped me a lot in my rotations. Just having that background in nursing and understanding what a nurse does and going through that work too.
I totally appreciate that. I was a caregiver. I used my EMT as a CNA. So I worked in caregiving, and that's how I got to the nursing side, the CNA side, the doctor side. It's really helpful to have the knowledge from personal experience of what all aspects of healthcare is for patients.
Yeah, definitely. For example, I was doing my rotation at a federal healthcare center here, and I was doing my internal medicine rotation, and we needed to get D-dimer lab stat. And all the nurses were busy. It was a busy day. And then I just go up to nurses. I'm like, hey, I can draw the blood. And they're like, they look at me like, really? I used to teach all the new grads to draw blood. I was like, I can definitely do it. And then when I went to the room, the patient was like, oh, man, not another needle stick. Everybody has been having a hard time drawing blood. I just calmed them down. I like to joke around with my patients. And I was like, oh, I'll be fine, don't worry. And then I go in and I get his blood right away. And he was shocked. He's like, oh, wow, this is like the best blood draw I've gotten this week. And it was a reminder for me, oh my God, I've come such a long way from being a nurse in medicine. I was able to help a nurse with a stat order, and I put in the order. I drew the blood and I sent the blood. That made me realize, oh, wow, I've learned a lot in medicine and nursing as well.
I bet. And I'm sure that was so helpful for the patient team. It sounds like that you were able to be really hands-on and help in whatever way they need. I know you mentioned psychiatry. I'm interested what brought you to that next path in your medicine journey.
Yeah, I'm happy to share. When I went into medical school, my goal was always to become a family medicine physician. Just working as a nurse in different areas of medicine, I really got to appreciate all the different levels of medicine, and family medicine's for me. And to this day, I still like it a lot. But then it was my first year of medicine, and I got introduced to this program called Unconventions, and they really focus in orthopedics residency and working as a surgery nurse. I really love this. I've seen a lot of surgery cases. I've been part of a lot of surgery cases, been a scrub nurse as well. So then I did my summer internship at Mayo Clinic in Rochester in orthopedics, and I loved it. To this day, my mentor, Dr. Hidden, and Dr. Bradford have been amazing, amazing orthopedic women in surgery. They've been great. They've been very supportive of everything, and I did research with them. But when I started my third year of medicine, I was really challenged in what I wanted to become in medicine. There's two reasons why I'm pursuing psychiatry. One of them is because family side and what my daughter went through, and then also my rotation in my third year of medical school. I'll start with the rotation in third year medical school. Psychiatry was my second rotation, and I absolutely fell in love with it. Just working with child adolescent psychiatry and adults, I loved it. I saw the impact that was being made every day in patient care, and I knew that I wanted to be part of that team. I think also because there's a lot of stigma against psychiatry, especially in the Latino community. I knew that there's a lot of work that still needs to be done, and I want to be part of that work. And just being at rotation, I remember still I used to go to my rotation, see the patient that they gave me, and then I used to go home and then log in the computer and then check on them to see how they're doing. And that's when I realized, oh my God, I'm investing so much time even though I'm not in the hospital. That's when I realized this is what I like a lot. The other reason is because when we went to Rochester and Mayo Clinic for my summer internship, we were actually in a car accident. They crashed us from behind, and we were all okay, except for my daughter. My daughter suffered a traumatic brain injury. She had some nerve damages, brain nerve 10, and it really limited her to what she can do to her full capacity. She saw a lot of orthopedics care, neurologists, and then a psychiatrist. And she saw her orthopedic, she saw her neurologist, and there was nothing else that pretty much they can do. Like for them, she was at her full function. That was 3 months after the car accident. But we just knew something was not okay. And we saw a psychiatrist, the one that made the biggest difference to bring her back to her quality of life, back to her baseline, to her enjoying life and being her full potential was a psychiatrist. And that's when I realized orthopedics did their job, neurologists did an amazing job as well. But it was really the psychiatrist that made her flourish again, enjoy school again, get good grades again, made her able to thrive again, despite having a traumatic brain injury. Seeing what my daughter went through, she really motivated me to look more into psychiatry and pursue psychiatry. And then that's when I had my psychiatry rotation. I was like, this is it. This is what I love. And I think this is where I can make a big impact, not only in all populations, but also the Latino population as well. I think there's a lot of work that needs to be done in psychiatry.
I completely agree with you. And I am so sorry to hear about that accident. That sounds so scary and terrifying. I'm glad that you've been able to get the right resources to help your daughter. It's really inspiring to hear that because traumatic brain injury is common, but not a lot talked about. We're still learning a lot about it. So it's really good to hear how different aspects of medicine have been able to help her. You mentioned also being a Latino, and I'm a Latina, so I get it. The stigma in the Latino community about talking about mental health or having mental health conditions. What has been your experience being a Latino when you were in clinic, talking to patients that speak Spanish or anything? I would love to hear your experience.
Yeah, so I'll tell you two experiences. The first one would be about my rotation in psychiatry, and then second one I'll tell you about my friends, my group of friends that are Latinos as well. On the first one, I was in my psychiatry rotation. It was like I think it was Monday or Tuesday evening, and we had to do a consult at the hospital for capacity. And the patient was Latina in her 60s, didn't speak English. And the consult was because a surgeon, cardiologist, needed surgery. And according to her, she was refusing surgery and they wanted to assess for capacity. It was life-saving surgery, which it's important. So I went to the room and immediately I can just tell that she felt comfortable. And I go there and I was like, oh, when I started, and she lit up so happy that somebody spoke Spanish that was not a translator on an iPad. Right away, I asked her those capacity questions, and I find out it's not that she didn't want the surgery, she wanted her family present when she made the decision, and she wasn't able to communicate that through an iPad. And then that's when I realized the importance of Spanish in healthcare. But it's not only the Spanish, it's also understanding the culture, right? So like you can speak Spanish, but understand the culture as well is equally as important. And Latinos, especially like my family, we're very family oriented. We're like family nucleus, all that. Once I understood right away that it was because she wanted her family to be present when she made the decision. It was a simple fix. Like I called the surgeon, I was like, hey, like she has full capacity, but the actual reason why is because she just wanted her family to be present when she made the decision. Like she wants to get surgery. And it was a simple fix, but they didn't catch it. So that kind of made me motivated more. I was like, okay, we need more doctors that speak Spanish in general in medicine. And so that was my first experience. And I realized the true impact that we were making even as a medical student. And then the other one, we can talk about the stigma about psychiatry and the machismo in Latino culture, right? So like machismo is like when it's a culture, it's very hard to describe, but it's a culture that is like very male dominated, like that perception. I believe men, it's very hard for us to talk about our feelings. It's very hard for us to talk about our mental health well-being. And I still remember to this day, I went to go see my friends for the Super Bowl. And if the Niners went to Super Bowl, we had a big party and everything. And I told them, I was like, they asked me how's medical school, everything. And then, do you still want to become a surgeon? And I was like, actually, I want to become a psychiatrist now. And at first, they were like, oh, really? And then when I started talking about it, they're like, oh, man, you're perfect for that. We watched the Super Bowl and then we went outside. It was just guys in a circle, kind of Socratic circle, talking around the fire pit. It's so funny because they opened up to me, and one of them was like, "Oh, I just started seeing a psychiatrist last week," and I told him, "I'm so happy for you." And the other one was like, "Oh, I would like to see one because I'm having XYZ problems. How can I go about doing that?" But I don't want my family to know. And then other friends too, they were curious about it, but to them was something that's not really talked about. I felt like they felt comfortable enough to talk about it with me because I told them I'm their friend and I told them I want to become a psychiatrist. And that's when I realized, oh wow, there's a lot of work to be done in the Latino psychiatry field just to make it more welcoming, that it's okay to see a psychiatrist. We need it. That really motivated me because I saw the work that needs to be done.
That's amazing. I appreciate you sharing that story and demonstrating how important it is to share experiences of challenge and struggle. It's interesting how by just being open and just by saying you're a psychiatrist, people feel more safe to talk about their mental health. I'm excited to see you go into the psychiatry field because you will really make a huge difference in being able to help. I also noticed that when I had family come for my graduation, and just by knowing that I matched psychiatry, people are more open to talking about their emotional struggles or starting therapy and stuff. It's amazing how this is stuff that they had never opened up before, but it's really inspiring to hear how much, even in our own family and nuclear circles, we can make a difference.
Yeah, definitely. I love my group of friends, but they like to put a tough front. And then it was just nice to see them a different perspective. As soon as they told me I'm a psychiatrist, I feel like they were more comfortable and they opened up more. It was a nice moment that I think I'll never forget.
I also want to thank you. I think you're the one of the handful of people that identify as males on the podcast. It's been hard to find individuals that are willing to talk, even non-Hispanic. It's hard for people to open up about their struggles, but
And
sometimes a little bit more individuals who identify as males.
like I said, my point of this is I want to motivate others and know that there will be challenges along the road. It's part of life, but don't give up. Whatever your passion is, don't give up. Even if people tell you that you can't, or statistically it's impossible, like me being a teenage parent, I was never supposed to become a doctor. And yeah, I'm in medical school now. There's statistics for a reason, and you can prove statistics wrong.
Yes, I love it. I was going to ask you for advice and pearls of wisdom for other individuals, and you
Yeah.
already did it. Do you have any other pearls of wisdom from your journey that you'd like to share? Maybe other student parents out there?
Yeah, definitely. A couple words of wisdom. Have a very supportive circle that supports you in whatever way that looks for you. Make sure you surround yourself with friends that motivate and uplift you as well. There's going to be a lot of negative comments, which is natural for people to say stuff like, you're a parent, you can't do XYZ. How are you going to work and raise your kids? And I know personally, when I became a parent at a young age, a lot of people told me, go into construction because that's what Latinos do. And I was like, construction's cool. I love it, but it's not something I want to do. You just have to ignore that background noise and focus on what you want to do, and then seek help, seek support. I've gotten so much help by just sending an email or calling. Even financial aid departments, I'm like, hey, I'm struggling financially. What can I do? And it's really taking time away from me studying. And sure enough, there's help. So I guess my biggest advice, when you need help, ask for help. Don't be afraid to ask for help because just as you're struggling, maybe other students are struggling as well. And if there's no help, make the pathway for other people to find help. Change the system.
Yes, I love it. Seek help, support, ignore the background noise. You can't control other background noise, but you can control how you listen and how
Yeah.
you respond to that
Yeah.
background noise.
Yeah.
As we finish up, I'm going to summarize a little bit of the journey that you did. You came from a first generation household, had children on your beginning part of your pre-med journey, and you went from community college to undergrad at UC Berkeley, even though you were struggling while working, maybe challenges with grades, but that didn't stop you. You were able to get in and get a full scholarship tuition, which is phenomenal to support you in your dreams and education. And you were able to become a nurse, see that side of healthcare and understand how different health professions interact with the patient, work together. Even then, you still had that dream of being a doctor and found ways, even if that involved sleeping in your car or doing those extra things to really keep going and motivating you. You were able to get into medical school where you went on an interesting path for specialty, started with family medicine, which I can totally get. I was similarly on that path. Then you dabbled in ortho a little bit, but a car accident and experience with your family really helped you understand where your passions, where's the need, and that led you to the psychiatry field where you can make a unique difference in the lives of others, particularly the Latino population. It's so important to understand the culture, how important family is, and use your experience to bridge that gap to really connect them with the resources you need. And then you finished off just inspiring us to keep your friends close, make sure you have a strong support system. We all struggle in our own way, so seek help. And if that help isn't available, make your own support and make sure you give back and support to help others. So thank you, Juan, so much for joining us today. I look forward to seeing your path for psychiatry. Hopefully you'll be able to use a little bit of I have an online blog post that I created about my psychiatry journey because I did dual family medicine and psych, and it's just ridiculous how competitive it
Yeah.
has become. I don't know if your school has talked about it.
They have, yeah.
No, it was like, I don't know. There's a lot, I would say about only 60% of our class that applied, got into psychiatry, but thankfully all of them were able to match into something that they're passionate about, whether that was through soaping or dual applying. Know that you will become a doctor. It'll just be an additional challenge, and you're good at challenges. It's a challenge that you're ready, I'm sure.
Thank you so much for having me, Dr. Moss. It's been great. I hope at this podcast, everybody gets motivated wherever you are in your pathway, whether you're starting high school or undergrad or community college, you can do it. Just set your mind to it and do it.
I love that. Thank you so much, Juan. If individuals would like to contact you or get in touch, how can they best do that?
Yeah, I think email would be the best way. Yeah, it's medina.echeverria@gmail.com. And I'm happy to help anybody that, that wants any advice or get into medical school by community college or anything like that. Or if you know somebody else that needs help, happy to connect in any way possible.
Amazing. Thank you. I'll make sure to link your email below and my email. That is, of course, for anyone interested in doing that path of psychiatry. So we're listening to Life as a Patient Doctor. If you're not subscribed on YouTube or on podcasts, make sure you do that so you can get other students and other healthcare providers so you can listen to them sharing their journey on resilience to bring back a little bit of humanity in medicine. You can also find me on all social media platforms at MedPsychMoss and tons of resources on my website. And I also just created a worksheet for all the medical school years to really help on those key challenges, whether that's steps, leaves of absences, accommodations, things like that. So I hope it helps others. And thank you all for joining. Take care.